AM Best has assigned a negative market segment outlook to the U.S. Medicare Advantage and Medicaid managed care sector, citing several adverse factors affecting each government health insurance-related program. This marks a new market segment outlook for the government program sector by AM Best. I'm John Weber for AM Best TV, and we're joined today by Financial Analyst Tim Willey, who's here to explain a bit more behind the decision. And Tim, what was part of the reasoning for establishing this outlook for the Medicare Advantage and Medicaid segment, and what tipped it to negative?
So we're assigning a negative outlook to the government program segment of health insurance, which includes Medicare Advantage and Medicaid managed care. Both segments have seen strong operating results in recent years, but several adverse trends over the last year or so have pressured results for carriers in these segments. A lot of these trends do relate to the impact of COVID-19 in some way, shape, or form.
And what kind of pressures are present in the Medicare Advantage segment?
Overall, Medicare benefit utilization has risen since 2023 and through 2024 as many patients delayed necessary care during the pandemic. This has led to some level of pent-up demand and higher cost claims due to patients not getting the necessary preventative care that they should have been. Several other factors are also pressuring the segment. As many people age into the Medicare program, some carriers have noted that an uptick in new members that have delayed necessary care until reaching eligibility in order to receive the enhanced benefits and lower out-of-pocket costs of the Medicare plans. Plus, there are also regulatory factors that are contributing to the negative outlook. With the Inflation Reduction Act of 2022, Medicare Part D plans will be required to cover a larger amount of prescription drug costs due to new out-of-pocket maximums. For Medicare Advantage plans that include Part D, this will go into effect in 2025. There are also pressures from CMS, the Centers for Medicare and Medicaid Services. 2025 reimbursement rates to Medicare Advantage plans from CMS came in below industry expectations. There also appears to be a declining trend in star ratings for Medicare Advantage plans. CMS assigns star ratings, and plans rated 4 stars or higher receive bonus payments that can be very beneficial. Plans use these bonus payments to benefit members in the form of lower premiums or additional benefits. The last pressure I'd note on Medicare Advantage plans relates to the use of a new risk adjustment model being phased in by CMS to determine reimbursement. The new model is being phased in over a 3-year period, and it is projected to lower 2025 risk adjustment payments by about 2.5%.
Tim, what kind of conditions do those in the Medicaid managed care sector face?
Sure. So Medicaid carriers saw what was basically unsustainable enrollment growth during the pandemic due to the federal public health emergency declaration. This made states unable to disenroll members from Medicaid, and enrollment grew tremendously. The public health emergency was lifted in early 2023, and carriers have dealt with the process of eligibility redeterminations, which has led to a sizable decline in enrollment. As of July 2024, total Medicaid enrollment had declined by over 70 million. On top of this, the members who were disenrolled were generally the healthier members of the Medicaid population. While carriers were prepared for this to happen, rate increases haven't necessarily kept up with the now higher risk profile of the Medicaid population. And then another impact to the Medicaid segment results has been a higher trend of use of behavioral health services from members.
So what does AM Best expect in the near to midterm for the segment?
We expect to see continued pressure in these segments in the near to midterm from the various factors that have impacted returns. For Medicaid specifically, we expect the segment to return to more historical levels once rates fall more in line with the current member risk profile, though this may not be until late 2025 or even 2026. Both segments saw outsized profitability in recent years due to enrollment growth and lower utilization during the pandemic. Medicare Advantage continues to gradually become a larger portion of total Medicare enrollees, and Medicaid enrollment had really benefited from the lack of eligibility redeterminations during the public health emergency. Government programs by nature are high volume, narrow margin segments, and these factors could lead to margins below historical norms. Less diversified carriers with concentration of business and government programs could be the ones that are really the most challenged. Still, many of the large health insurers have faced headwinds before, and they've shown they were able to navigate these challenging environments.
Thanks, Tim.
Thank you.
That was Financial Analyst Tim Willey. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.